All right, let's take a look at chapter 7. So if you have my notes for chapter 7, I'm not going to spend time with everything that I put in there. I'm only going to skip around and hit a few of the highlights here in chapter 7. So starting off, chapter 7 deals with the skeletal system, mainly gross anatomy. Looking at the bones in this chapter. So the thing is, we've covered most of this in the lab portion of the class. So I'm just going to hit a few things in here. All right, so we already talked about the axial skeleton, that's the skull, vertebral column, ribs, and the appendicular skeleton, which is the arms and legs and pelvises. All right, so let's take a look at some things in the skull. So our skull has some sinuses in there, and so this is a good picture of those sinuses. So these are air spaces in cranial bone lined by mucous membranes. All right, they give voice resonance, and they also help reduce the weight of the skull. Now, one of the things about our skull is we have these sutures in there, and those sutures provide no movement whatsoever. We'll come back to those in chapter 8. When we're a fetus, we have these things called fontanelles. And fontanelles are these membranous regions in newborn skulls. So there's shown one here, there's another one here, there's a top view, there's another one there and there. All right, and what these do is they allow the skull to compress during birth. In actuality, that anterior fontanelle doesn't completely close up, harden up until about the age of 2. All right, let's take a look at our vertebral column. So our vertebral column is made of 33 vertebrae, and our vertebral column has this odd shape to it. So to allow us to be upright, we have to have literally 4 curves in our vertebrae. So we have a cervical curvature, thoracic curvature, lumbar curvature, and then you can see the sacral and coccyx regions. We have that another curvature as well. All right, and this is what leads to a lot of people having back problems over time. It's because gravity is going to push down, it's going to pinch those discs between the vertebrae together, and so on. All right, so let's take a look at some abnormal curvatures. Okay. So the first is called lordosis. Now, green is showing the typical curvature, and so red is showing the abnormal curvature here. So lordosis is an abnormally exaggerated lumbar curvature. So you can see that exaggerated lumbar curvature. This is usually due to a heavy midsection. So women can have this during pregnancy, or guys with a beer belly, stuff like that. Okay. Next is kyphosis. Kyphosis is an increased roundness of the thoracic curvature. So this is also known as a hunchback. All right, so once again, green is typical, red is abnormal. So this woman here has that kyphosis there. Okay. Lastly is scoliosis. Scoliosis is an abnormal lateral curvature. Once again, green is normal, the red is the abnormal curvature there. All right, and so this is showing somebody with really bad scoliosis there, not x-ray. Okay, so let's go ahead and move to the appendicular skeleton. So, all right, and so the main thing that I'm going to look at here is looking at the sex differences in the pelvis. And those sex differences are there for childbirth. So if we look at this picture here, all right, so first of all, females have thinner, lighter, and smoother bones in general. All right. Next, the acetabula are smaller and further apart. So the acetabula are where the head of the femur bones attach in. So this right there and there, there and there, those are acetabula. So those are these cup-shaped processes. Next, the pubic arch is wider. So here they're calling that the subpubic angle. Right, the pubic arch on the male there it is on the female, much wider on the female. Next, the female coccyx is straighter and movable. So this is the coccyx, the tailbone. So there it is on the female, it's straighter, so it doesn't curve so much in, and it's movable. So it's not movable on the male. Next, the female pelvic inlet and outlet are wider. So the inlet is the opening at the top of the pelvis, the outlet is the opening on the bottom of the pelvis. So it's wider on the female in both cases. Lastly, the female ischial spines and tuberosities are smaller. So the ischial tuberosity is essentially in this area. That's where we see muscle attachments, so you'll see a roughening of the bone. And then here is showing the ischial spine right there. So right there is the ischial spine, and it's smaller on the female, so the openings can be larger there.